Recurrent implantation failure. What recurrent implantation failure is? To know what RIF is, we first need to know what implantation is. Implantation is a cascade of interaction between embryos trophoectoderm, this is the embryos, the embryo trophoectoderm and the endometrial surface and glandular epithelium. So it is the interaction between the embryo and the endometrium. It requires 3 steps. First is the embryo apposition. Embryo apposition means this embryo is there, it is getting opposed to the endometrium. So embryo is coming over the endometrium, then it is getting adhered to the endometrium. Second step is adhesion. Adhere means glued, it is getting glued to the endometrium. The third step is burial, it is getting buried into the endometrium, so it is invading the endometrium. So the 3 steps are, firstly it is getting opposed to the endometrium, then it is getting adherent to the endometrium, and finally it is getting buried into the endometrium. Apposition, adhesion and invasion. But what implantation failure is? Patients who have never shown quantifiable signs of implantation. Quantifiable signs of implantation is increase in the level of beta HCG. So that is a quantifiable sign of pregnancy or implantation. So patients who have never shown quantifiable sign of implantation, or even if the quantifiable sign of implantation are there, but there is no evidence of gestational sac, so that also is implantation failure. Mere increase in beta HCG doesn't mean implantation. That will come into the implantation failure only. Means implantation started but it failed. So recurrent implantation definition is something which include many variables. So what are the different variables which are included in the definition? To form a definition of RIF, we need there are a lot of variables. First is the number of embryos transferred. So some people say like number of embryos transferred are like 2 embryos, 3 embryos. So it is like variable. Definition of number of embryo transfer is not, some standardized thing is not available about it. The number of IVF and ICSI attempts, somewhere it is 2 IVF attempts, somewhere it is 3 IVF attempts, that also is not standardized. Third is the embryo quality. Some definitions do not include the embryo quality while they are defining the RIF. Ideally, RIF should mean when the good quality embryos are getting transferred, then still the patient is not able to show the sign of pregnancy, because good quality and poor quality embryos inherently have a situation that they inherently have do not have a good potential to implant. So RIF in itself is something which can happen if the embryo is not good quality. But if the embryo is good quality, still it is not getting implanted. So that is something which should be pondered about. Fourth is maternal age. So advanced maternal age is anyways a poor prognosis. But if the patient who is less than 40 years of age, still again and again implantation is not happening. So that is something which is more which should be considered, and this should be included in the definition of recurrent implantation failure. So these are a few variables, 4 variables: number of embryos transferred, number of IVF ICSI attempts, embryo quality and maternal age. Using these variables, different combinations, several definitions of RIF have been proposed without a universally accepted definition being present. So once in like 2005, the ASHRAE PGD consortium definition of RIF came. So what they told: failure to achieve clinical pregnancy after more than or equal to 3 unsuccessful transfer of high quality embryos, or failure to achieve clinical pregnancy after cumulative transfer of more than 10 embryos, more than or equal to 10 embryos in multiple transfer. But these 2 definitions were not adequate. Why they are not adequate? As you can see here, they have not included they have included high quality embryos, that is good thing, but they have not included the female partner age, and number of cycles also are not included. Number of embryos also are not included. More than 3 unsuccessful transfers they have written, but how many embryos were transferred, that is not included in it. In the second definition, you can see they have included the number of embryos, but how many cycles, what is the age of partner, female partner, this nothing is included. So these are both incomplete definitions. So the definition, if it is based on number of embryos transferred with number of unsuccessful cycles, that it can be 2 or more embryos transferred during 3 or more unsuccessful or failed cycle. Here we can see if 2 or more embryos are transferred, number of embryos are included. 3 or more unsuccessful, so cycles are also included. In another definition, which is based on number of embryos transferred cumulatively, okay, in combination with the number of unsuccessful cycles. Cumulative transfer of 10 or more embryos during 3 or more unsuccessful or failed cycles. So these are different trial of, like, these can be, the definition of RIF can be based on number of embryos or number of unsuccessful cycle, which the embryos can be separately taken or cumulatively taken, but still these are not very adequate one. Finally, a recent approach by Colin et al., it came into practice. They defined the definition of RIF very nicely. So, failure of pregnancy achievement after transfer of at least 4 good quality embryos. Okay, 4 good quality embryos they took. Second thing which they took in the definition, minimum of 3 fresh or frozen cycles. Okay, minimum of 3 in a woman under 40. So they included everything in the definition. First is 4 good quality embryos. Second is 3 fresh or frozen cycles. And third is under 40. So this completes the definition. So the crux of this whole topic is what the definition of RIF is, that is given by Colin et al. That is at least 4 good quality embryos in a minimum of 3 fresh or frozen cycles in women under 40 years of age. So this is what the recent definition of RIF is. So I hope now it is clear to you. Thank you.